Healthcare in Gaza has collapsed. Medical personnel exhausted after 3 months' war have been forced to remove shrapnel without adequate pain relief. He is forced to amputate without anesthesia and watch children die of cancer due lack facilities and medicines. Dozens talks with doctors. Medical executives in Gaza reveal a catastrophic and worsening situation. As health services struggle to cope with the effects, tens thousands casualties, acute humanitarian crises due to ongoing Israeli attacks in the region. Attention has focused on direct losses of Israel's military offensive in Gaza. But medical experts are increasingly concerned about the indirect victims of war. Tens of thousands of people with chronic, life-threatening diseases in Gaza have not been treated for months and are now vulnerable. Their bodies are weakened by malnutrition, cold and fatigue, doctors say. In an incident told The Guardian, a child with a brain disorder hours before the UN team arrived with vital drugs. He is a Palestinian cancer patient who was treated at the Nasser hospital in Han Yunus in November. Mohammed Salem Cancer experts told The Guardian they could not treat patients in urgent need, including children or tumors with leukemia who require emergency life-saving surgery. We can't operate and we have no drugs either, said Dr. General Manager of the Turkish-Palestinian Friendship Hospital in Gaza, Sukeyk Subhi. The hospital's main oncology department had to close in early November. There are people with cancer who attack their lungs, bones and lungs. I need to explain to them their situation and that there is nothing we can do. We have patients with leukemia, including many children who among them, they have no defense mechanism, no immune system and are very vulnerable in this environment. Sukeyk said that a man brought his son with him every day for 3 weeks. The child has a tumor in his throat that grows rapidly and will soon stop him from breathing. They come every day and I have to say that there is nothing we can do every day. I can do this operation without difficulty, but we cannot. This is terrible, said Sukeyk. Of the 36 hospitals in Gaza, only 15 are open and only 3 are undamaged. According to Palestinian health officials, 350,000 people in Gaza have chronic diseases and almost all drugs are missing. One of the biggest concerns is the drugs that treat high blood pressure, as well as psychological diseases in which drugs are almost exhausted. In crowded and unsanitary conditions, diseases spread rapidly. All children have diarrhea or a chest infection. And Hussein Awda, 37, who now says he has too much hepatitis A, since his house was demolished. He lives with his family at a UN vocational training school west of Han Yunus. Relatives killed at the beginning war. A boy evacuated from Gaza for treatment in Egypt. Very few people manage to leave that way. Anadolu attempts are being made to reopen Al Healing Hospital, Gaza's largest hospital. Why?